My hip area, it's tight.
What happened?
My right side went numb. I went to the doctor, ran tests, blood was fine, so he said just in time it'll go away. So it did. Because I fly a lot, and also if I'm driving, then literally the arm would go numb. Okay. So then I would have to change the position, you know, the way I was sitting, and so then the numbness would go away. If I'm standing, and I'll keep my feet planted, and I rotate, then I can get it to twinge, right, and then I'll feel it, you know, all the way up and down. But if I stand here and I do this, right, then it starts to it'll let me know that it's there. Working out, it'll remind me of what's going on.
I'm referring the medial aspect here with the sacrum there. When it goes down, when it misaligns PI, it naturally is going to go out. When it goes up, it wants to go in. ASIN, PIEX. You have a PIIN. So it goes against the normal movement of the SI joint, tells me trauma. The left pelvis goes down and it turns in. The sacrum on that side turns left, so your overall body favors to the left. There was a hip trauma and you are complaining of hip symptoms, but I don't know the hip is causing your specific. I think it may be a piece of the puzzle.
Okay.
My suspicion it's down in this area, in the tailbone. 20 points up top, C1. C2 is wedged on the right, C1 is wedged on the left. There you go. 6 more tender, 7 more tender. 6. S4 or S3?
S3.
Gotcha. There you go. Down, down. Nice. Home run. That was beautiful.
So if I do this, right, before you did the adjustments, if I do that, I could feel it. Now that really is crazy. Off my hip, so that's a big improvement, so I can rotate without any type of twinging.
L5 is gone to the right and down, so it's turned that way. Sacrum is also turned that way. By pushing the sacrum forward, it's going to get rid of some of that rotation. But what I'm going to do is I'm actually going to torque 5. I'm not going to torque the sacrum. And that's the home run. Come on up.
Woo! Okay, that's good.
Came in for this hip.
Correct.
It was nagging you for several years.
20.
That's a lot of years. So tell me about the last 2 months with the body.
The biggest thing is just overall mobility. My feet are pointing, you know, east and west, where now I see my toes more, right? Because it's crazy how they came in, but
You're pointing North Pole now?
yeah, it's crazy the range of motion or the mobility that has increased, you know, in the gym, which is nice.
9. I'm getting a tiny bit in the sacrum. That's it. Yeah, you are walking straighter, dude. That's really cool, dude. Watch his feet. That's freaking cool. That's
No, seriously, like walking in the airport and stuff, you know, you just kind of notice your toes.
Mm-hmm.